The World Health Organization has declared the recent Mpox outbreak a public health emergency of international concern. This is the highest level of alert the WHO can issue. It signifies a serious health threat that requires a coordinated global response. The decision was made due to the rapid spread of the virus, particularly in the Democratic Republic of Congo. The country has reported a surge in cases, overwhelming its healthcare system. The WHO's declaration is a call to action for the international community to provide support and resources. The Democratic Republic of Congo is facing a devastating Mpox outbreak. The number of cases is rising, overwhelming the fragile healthcare system. Hospitals are struggling, especially with many child patients. The situation is dire in rural areas. Limited healthcare access and poverty worsen the impact. Poor sanitation and lack of clean water aid the virus's spread.
The DRC has battled Mpox for decades, but this outbreak is one of the worst.
The current Mpox outbreak is linked to a new strain of the virus, Clade 1b. This new strain is characterized by its rapid spread, particularly through sexual networks. This marks a departure from previous outbreaks, where transmission primarily occurred through contact with infected animals.
Clade 1b appears to be more transmissible than previous strains. It spreads easily through close, often skin-to-skin contact, including sexual contact. This has led to a surge in cases, particularly among men who have sex with men. The emergence of a new strain highlights the constantly evolving nature of viruses. It underscores the importance of ongoing surveillance, research, and the development of effective vaccines and treatments. The new strain's transmission pattern through sexual networks necessitates targeted public health interventions. These interventions include comprehensive sex education, increased access to condoms, and contact tracing to identify and isolate potential cases.
Children are bearing a disproportionate burden of the current Mpox outbreak. The virus is particularly dangerous for children under the age of 5, who are more likely to develop severe complications and die from the disease. Several factors contribute to the increased vulnerability of children to Mpox. Children's immune systems are not fully developed, making them more susceptible to infections. Malnutrition, common in many Mpox-affected areas, further weakens the immune system, increasing the risk of severe illness.
The high number of children affected by Mpox is a cause for serious concern. It highlights the urgent need for interventions specifically designed to protect this vulnerable group. These interventions include prioritizing children for vaccination, ensuring access to pediatric care, and implementing preventive measures in schools and childcare settings.
The Mpox outbreak is no longer confined to the DRC. It has spread to neighboring countries, including Burundi, Kenya, Rwanda, and Uganda.
These countries, which had never reported Mpox cases before, are now grappling with their own outbreaks. The virus's spread beyond the DRC is a worrying sign.
It indicates that the outbreak is not contained and has the potential to become a regional or even global health crisis. The international community must act swiftly to prevent the further spread of the virus.
The emergence of cases in new areas highlights the importance of strong surveillance systems. Countries must be able to quickly identify and isolate cases to prevent further transmission.
This requires investment in laboratory capacity, contact tracing, and public health infrastructure. The spread of Mpox to new countries also underscores the interconnectedness of global health security.
A disease outbreak anywhere is a threat to health everywhere. International cooperation is essential to effectively respond to outbreaks and prevent them from becoming pandemics.
The new Mpox subtype, Clade IB, presents challenges for diagnosis. This is because its symptoms can be similar to other common illnesses such as chickenpox or measles. This can lead to misdiagnosis and delays in treatment.
Timely and accurate diagnosis is crucial for effective Mpox control. It allows for the prompt isolation of infected individuals, breaking the chain of transmission. It also enables healthcare providers to initiate treatment early, improving patient outcomes.
The lack of accurate and readily available diagnostic tools in many Mpox-affected areas is a major obstacle. Current diagnostic methods, which rely on laboratory testing, can be time-consuming and expensive. This is particularly problematic in remote areas with limited access to healthcare facilities.
There is an urgent need for rapid diagnostic tests for Mpox. These tests would allow for quick and easy diagnosis at the point of care, even in resource-limited settings. This would significantly improve outbreak response efforts and help to contain the spread of the virus.
The international community has responded to the Mpox outbreak with pledges of financial aid and vaccine donations. The United States, for example, has committed millions of dollars to support the response in affected countries. However, the current level of funding falls short of what is needed.
Addressing the funding gap is essential for scaling up essential interventions. This includes increasing access to vaccines, providing essential medical supplies, and supporting affected communities. Without adequate funding, the outbreak will continue to spread, causing unnecessary suffering and loss of life.
The WHO has called for $100 million to effectively respond to the Mpox outbreak. This funding will be used to support surveillance, laboratory testing, contact tracing, infection prevention and control measures, and risk communication and community engagement.
A coordinated global effort is required to ensure an equitable and effective response to the Mpox outbreak. This includes increased funding from governments, international organizations, and private donors. It also requires collaboration and coordination among all stakeholders to ensure that resources are used effectively and efficiently.
Despite the international community's initial response, the Mpox outbreak continues to pose a significant threat to global health security. The demand for vaccines, medical supplies, and financial aid far exceeds the available resources. There is an urgent need for increased support from the international community.
A sustained and coordinated global effort is essential to control the outbreak, prevent further spread, and mitigate its impact on affected communities. This includes scaling up vaccination efforts, strengthening healthcare systems, and addressing the underlying factors that contribute to the virus's spread.
The international community must prioritize the Mpox outbreak and allocate sufficient resources to support affected countries. This includes providing financial aid, technical assistance, and essential medical supplies. It also requires raising awareness about the virus, promoting prevention measures, and combating misinformation.
The Mpox outbreak is a reminder that infectious diseases do not respect borders. A disease outbreak anywhere is a threat to health everywhere. The international community must work together to strengthen global health security and prevent future outbreaks. The Mpox outbreak is a race against time. The virus is spreading rapidly, and the number of cases is rising daily. The longer it takes to contain the outbreak, the greater the risk that it will become a global health crisis. The international community must act now to prevent the Mpox outbreak from becoming another pandemic. This requires a coordinated and well-funded global response that addresses the immediate crisis and strengthens global health security in the long term. The world has the tools and resources to defeat Mpox. What is needed is the political will and commitment to act decisively and collaboratively. The health and well-being of millions of people around the world depend on it. The Mpox outbreak is a stark reminder of the importance of investing in public health. Strong public health systems are essential for preventing, detecting, and responding to infectious disease outbreaks. The world must learn from this outbreak and strengthen global health security to prevent future pandemics.